My name's Melissa Herbst-Kralovetz. I'm a professor here in our Department of Basic Medical Sciences. I'm cross-appointed in obstetrics and gynecology, and I direct our translational women's health research program here on our campus. In our lab, we focus on studying host microbe interactions within the female reproductive tract. And that's in the context of a lot of different obstetric, reproductive, and gynecologic health outcomes. We've been doing this for over a decade now, and we've learned a lot about the cervical vaginal microenvironment. So that's what we're really focused on. We kind of realized unexpectedly that these biomarkers had a really nice predictive accuracy for predicting not only, again, local conditions like cervical cancer, for example, but upper reproductive tract conditions like endometrial cancer, adenomyosis. And so that's where we're going in the future. So one of the issues that we know that exist with regard to diagnosing a lot of these conditions in the upper reproductive tract is that all of the diagnostic procedures are incredibly painful, anxiety-provoking, and we feel like women deserve better. Basically, can we take those biomarkers that we've learned about and measure them locally in a non-invasive manner and predict what's going on in the upper reproductive tract so that women don't have to go through these painful procedures? Or we could prioritize who really needs to go forward with that procedure and when. So there's hurdles that for women to overcome, and we know those hurdles are even greater in underrepresented minority populations or women that live in rural areas. And so these types of non-invasive tests that could be delivered very easily without professionals doing those tests, they could even be self-collected. That's going to empower women to be able to seek out these tests and get the diagnosis that they need. So ideally, we'd love to develop a test that's akin to a Cologuard test or a PSA that we use for men, but for women, that they could monitor their uterine health over time, and then at some threshold, they might have to go for a more invasive biopsy, for example, but we could reduce the number of unnecessary biopsies and pain that these women are going through. What I would be looking for is someone that is passionate about women's health, helping women. Also, I know where my zone of genius is, and it's not in business or business planning. And so I think it would be great to have someone that's more business oriented, that has a track record as well, getting their product to a commercialization.